Hello, everyone, and welcome to this office hours on ESG-CV reporting. My name is Tommy Joe Bednar from Apt Associates, and I'm going to be sharing a few logistical and housekeeping points before we get into the meat of our office hours today. So, first and foremost, we want to make sure that all of you can hear us very well. If you're having trouble with computer audio or just want to make sure that you can hear our wonderful presenters even better today, those call-in numbers are on your screen right now. We find that phone audio is a little bit better than computer audio. I've also shared those phone numbers in the chat box on the right-hand side of your screen in case you need those to call in today. Our webinar is also being recorded. And that recording, along with the slides and materials from today, will be posted to the HUD Exchange within 2 to 3 days. So keep a lookout there for those materials from today. We also want to make sure that as an office hours session, you have the opportunity to engage with our panelists today and to ask questions. To do so, if you'd like to ask your question verbally or raise your question to the attention of our presenters today, please use the raise hand button at the lower right-hand corner of your screen. So if you look in the bottom right-hand corner, there's a little hand-shaped icon. If you click on that, that will raise your hand in WebEx and alert our panelists. When your question has been asked or you have the opportunity to ask your question, go ahead and click it again to lower your hand. To be able to ask that question verbally, if you'd like, please make sure to connect your audio. You all have the opportunity to connect audio to microphone settings now. If you're hearing this, you're connected to be able to hear this. But you have to turn on that audio connection to be able to verbally ask that question if you'd like. We do know that not everyone might feel comfortable verbally asking a question, and or you might just prefer to chat a question. We encourage you to use the chat feature on WebEx as well. That chat feature, if you click in the bottom right-hand corner of your screen, there's an icon with a chat bubble and the word chat. If you click on that, it'll open a chat panel on the right. Please make sure that all of your chats are sent to everyone so that everyone is selected in the to fields. That will make sure that all of our presenters, panelists, and your other attendees today can see your question and that we can answer it so that everyone can see it as well. And today's presenters will be William Snow from HUD, the Office of Special Needs Assistance Program, Michelle Budzik from the Partnership Center, Meredith Alstott from the Partnership Center, and some technical support from Apt Associates and the Partnership Center as well. With that, I am going to go ahead and hand off our Office Hours webinar to William Snow.
All right. Thank you, Tommy Joe. Okay, as a reminder, as with all of our office hours for ESG-CV quarterly reporting, that is the topic. We are going to focus on ESG-CV quarterly reporting. If you have topics outside that or questions outside of that topic area, we likely will not answer them. We may if we have the answer, but if we don't, we're going to refer you to the AAQ. So please bring you all the reporting questions that you have, and we will see what we can do. Today, this is our last office hours for cities and counties prior to when you start your reporting, although we are hopeful that most of you have opened up Sage already. We want to do a quick summary of things like clarifications and changes that have happened since the first webinar. These are areas that had lots of questions around them. These are not changes from the last time we met necessarily. They're just changes over the course of the last month. So we just wanted to raise them here so you can see them. Thankfully, it is mostly clarifications. There are only 2 changes that happened over the course of the last month, and we have talked about them in past rounds, so we'll just share them as a reminder. Okay, next slide, please. Okay. Wow, we've talked a lot about this fun topic, about who's who, right? So we all on this call probably know recipient gets the money, recipient kicks things off in Sage. That's really key. The subrecipient is the one who gets awarded money from the recipient, not from HUD, and it could be a subrecipient as well. They're entering data. The only subrecipient or subrecipient that will be involved with the data upload process or the CSV generation process will be victim service providers. No other subrecipients should be entering any sort, or feel like they have an obligation to run a CSV. That's not required for ESG-CV quarterly reporting. HMIS leads, however, you do have a lot to do. Based on the bundles that are set up by the recipient, you're going to create the files based on the projects that they put in there. So again, lots of work on the recipient side and setting up those correctly. We'll talk a little bit more about that today, but again, today we'll actually focus more on your questions. And again, at the bottom, you see the victim service provider reminder what role they have, and that's essentially the same as a normal annual ESG recipient or subrecipient. They will run their own CSV, and it won't get bundled with everyone else's. It'll just be their data like normal. And then the final reminder, recipient will continue to be the one to submit. So recipient starts the process and ends the process. If you can't remember if you submitted, please go back into Sage and verify. That continues to be an issue. All right, next slide, please. So this is one of those few changes we definitely made from the very first webinar. We clarified that temporary emergency shelter standards are slightly different than what we had said. So as a reminder, temporary emergency shelters have 3 core requirements. There is a definition. It's posted here. You can see it. The core elements to say whether or not you are a temporary emergency shelter are, and I'm going to read it here. Remember, we bolded it last time. I'll highlight those things. So structure or portion of a structure is used to provide shelter to individuals and families displaced from normal place of residence or sheltered unsheltered locations due to a natural disaster or public health emergency. So used to provide shelter for a public health emergency, i.e. COVID-19. That is key, right? It needs to be recognized as something that's needed. The second part, the local public health official determines that temporary emergency shelter is needed for the coronavirus response. That's the one we mentioned last time. We're going to provide more clarity on what documentation is required around that, but there does need to be some recognition from a public health authority that some form of temporary emergency shelter needs to be created to make sure that people who are at risk of or have been exposed to coronavirus have a chance to be isolated or quarantined as needs be, or other accommodations to prevent the spread. So that was item number 2. And the last one is you actually have to operate it during the period that the coronavirus is happening or during your response period. So January 21st, 2020 forward, all the way until, at this point, based on the notice, until January 31st, 2022, if you had a substantial amendment that was on September 1st or later. This actually could go longer than that if you assigned your substantial amendment earlier and included provision for temporary emergency shelter before that. So these 3 elements are here. You can read them on the screen. We've talked about them, and they continue to be the core ways to determine whether or not you have temporary emergency shelter. One of the key things from a more policy and practical perspective is you don't have to do a habitability inspection or an environmental review if you fall under that definition. It is not the case that you have to fail those things. It's simply that you do not have to do them. So that's important. It's kind of nice to know. It's one less thing for you to do. But please remember, most circumstances, you're probably not doing temporary emergency shelter, right? If you are a shelter that serves 100 people and you needed to spread them out, so you got 50 motel beds and you kept 50 in your shelter, so again, they could be spread out, you would keep that all in one project. You could do 2 projects if you want. That feels like a lot of extra work. So we give you that option, but really we recommend that you keep it in one project. We see that as really one project. You've just had to make some changes to how you actually operate it. So most of what you did during the initial phase was probably tied to an existing project. All right, next slide, please. All right, so just a reminder of kind of the do I have to report set of questions. So let's quickly go through this flowchart because this is really important. And again, I hope some of you report and finish your reporting today because you may not have to do anything other than essentially enter into Sage. So if you do not have an executed grant agreement with HUD, and again, the operative word there, or words, is with HUD. So no signed grant agreement. That means no reporting required. You don't have to enter Sage. And that the date on that is as of October 1. So if you have nothing signed by October 1, yeah, you're good to go. You have nothing to do. If you've only signed a grant agreement with HUD and nothing else as of October 1, then you will have to go into Sage. You'll have to go in and indicate, yes, I have an executed grant agreement. And then all you'll have to do is enter zeros in the financial section, and you're essentially done. If you haven't served people or spent money, you can't report on that. Right? There's nothing to report, so zeros. If you have signed or executed the grant agreement with HUD and costs have been incurred, then you need to report on those costs. And what you're going to report depends on what costs you've incurred. So if you have incurred costs with a project where they're only costs that are unique for the ESG-CV notice, so let's take training, for example. You conducted a training on how to safely administer case management or other types of assistance across your projects. You are not going to do a CSV on that. We don't ask for you to do some reporting. That's kind of an odd one to report on anyways in terms of people. All you're going to do is go in and tell us on a unique screen what the activity was. You're going to check a box that says, yes, I did this training activity, and this is how it was tied to preventing, preparing for, or responding to COVID-19. So again, if the only thing that you paid for in a project was tied to these unique activities other than temporary emergency shelter, then you're not going to provide a CSV file. You're just going to provide a narrative and financial information. That would apply too if you incurred HMIS or admin costs as well, quite honestly. You don't have to do unique narrative there, but you're just going to report on your financials and then submit. There's no CSV file. If you serve people, one person, even one person, then you're going to do a CSV file. And you're going to let us know, again, the money involved and the people served. So something we'll touch on with Michelle later, but I'm going to put on it a point in it now because it's really important based on what we talked about last time. Contracts. So when we're talking about executing a grant agreement, we are talking about one specific thing. We are talking about executing a grant agreement with HUD. We're not talking about your local grant agreement. So the trigger is if you've executed a grant agreement with HUD, then you're going to touch Sage somehow. If $1 has was spent, and it's going to be reimbursed from the ESG-CV pot, then you should be reporting on that. So here's an example. You have a subrecipient. You haven't concluded all of your subrecipient arrangements, but you have some of them, but you haven't reimbursed them yet. You know that they've expended money, but you don't know how much and you haven't reimbursed. We don't care about your reimbursement process. Not that we don't actually care, but for the purposes of reporting, we don't require that you have already reimbursed them. We need to know if you've spent, i.e. a subrecipient has spent any money, you need to report that. So you need to create a system for getting information about money expended by your subrecipients, even if you haven't reimbursed them yet. So we'll touch again on that later, but I wanted to make sure we highlighted again that was one area we've got lots of questions on, and we understand why, right? Like that's a confusing concept, but that's what we're talking about. So with that, I'm going to actually turn it over to Michelle.
Thank you, William. Let's move along to talk about bundles then. I just want to clarify that bundles kind of is a new concept. It's not, we haven't changed anything from when we started. It's just a new concept to get in your mind. The recipient identifies the projects, the dates they were operational, and the component types in Sage. Then Sage actually creates the bundles. Sage takes all of that information and decides what bundle each project is going to be in and sends that information over to the HMIS lead or victim service provider who actually generates the bundles. When the HMIS lead or victim service provider gets the information, it's because it's a single HMIS, that it's their HMIS or their comparable database that data has got to be pulled from. The component is the same component, so we're not going to put a rapid rehousing project in an emergency shelter bundle. It's got to be its own component bundle, and they're all running on the same date range. So Sage will tell you how to do that, and if you just follow the instructions, you'll get there. We had lots and lots of conversation about reporting start dates and went over that a bunch of times. Just in summary, you can't have a reporting start date before January 21st, 2020. And remember, a reporting start date means what date is the CSV upload report going to start. It doesn't mean what date are you starting your program. It means what date is that CSV upload going to start. And so it's the first date that the first regular ongoing emergency shelter street outreach began serving clients, or the date that if no emergency shelter street outreach funding was provided prior to October 1st, then the first date of any component other than emergency shelter. And we went through a whole exercise in trying to help you figure out when the best reporting start date was, and hopefully you remember that or can refer to the previous trainings on that one. This is kind of what William was talking about before. We talked a lot about, all the different scenarios that communities are in right now in terms of where they are in starting. HUD expects that everybody would have started by now. That would be the ideal expectation, right? And that most recipients have gone through, they've got an executed grant agreement, they've gone through their contracting process, and they're going to be able to report. We know this is not the ideal world and everybody's not all there. If you are there, though, the reporting expectation is that if you have expended funds on even one person during the period, you're going to report all of the expenditures and you're going to upload all of the CSVs that are relevant. Again, HUD is not looking at your billing issues with your clients. There's 30 days between the date that the reporting period ends and the date you have to submit, in which time HUD is expecting that you're going to be able to get expenditure information from your subrecipients in that period to be able to report it. We want to be clear, if you haven't entered into a contract with your subrecipients, no subrecipients until after 9/30, then you're not going to be able to report on them. And we are making arrangements then for you to report on all of that in the first quarter and somehow come back and be able to report on all of the client activities in the CSV upload and all of the financial activities. The other thing that changed, and this was kind of the result of the HMIS leads just asking for more time and HUD listening, was that from the date you send the email, you, the recipient, sends the email from Sage saying to the HMIS leads or victim service providers that it's time to upload their data, they have 3 days to check that information and make sure it's correct before they can upload. So Sage will remain open at that time, so if it has to be pulled back, you have to make corrections, we can do that, okay? At midnight on day 3, the system will lock And at that point, everybody uploads and there's no date changing. So that just gives people kind of a comfort level period of saying, whoops, I got the wrong project in my bundle. It's got, something got clicked wrong. And I think that's it. We're going to go to questions. Meredith?
Sure. We have a question here that William, I think, kind of answered in the chat, but I want to raise it again because I think you brought this up on the state call last week. Can you use more than one HMIS lead to download data to Sage? So do you want to explain setting up a single HMIS lead in Sage as a contact?
Yeah, I'll mention the requirement. Michelle, maybe this is a good time to show in the system where they enter that. If you want to pull that up while I'm sharing, because that's probably helpful. So to the extent you have projects in multiple HMIS implementations, every HMIS implementation is going to have to report on the project served in it. So that's a lot of words, but let's try to explain this. So let's say you're a jurisdiction that has state money and county money, or let's not use state. Let's say city and county. The city and county have two separate pots of ESG money, and strangely, also, or one pot of ESG money. Sorry, I'm ruining your example here. two separate COCs. That's actually the important thing here. There are two separate COCs in play here, and each of them have a different HMIS. And so you have projects in both. Let's say you have shelter in both of them. Well, you're going to have to get data from the city and the county and from each of their HMIS implementations separately because, well, the data is separate because they're in different HMIS implementations. So when you go into Sage in the HMIS or in the setup piece, you're going to have a chance to enter the contact information for each HMIS implementation, and you'll want to enter in the contact for both of them. You want to add to that, Meredith or Michelle, since I bungled the early example there?
No, you didn't. We just, I think it depends on how you're asking this question. There is one HMIS lead or one DV contact for every DV provider you fund has one DV contact, and every HMIS lead you would fund has a contact. So in this example, you can see that we have 4 different HMISs that are operational in this community. This is a state grant, and there are multiple victim service providers that are operational. So each victim service provider got one, and each person here. We've had lots and lots and lots of questions about, does it have to be just one person? And so if the one person was the point of your question, we want to go back and tell you that, again, this contact email does not have to be a person. It could be a distribution list at the HMIS. There has to be a person's name there and a single individual for you, the recipient, to be communicating with, but how they get that email could be a group email if that is their preference. But it has to be the HMIS that enters the data.
Yes, thank you.
Mm-hmm.
So how do we handle reporting for DV programs if the DV agency doesn't have a comparable database?
So I'm actually finishing typing up the response on that one, and I'll hit it as we go. The short answer is they're going to have to get one, right? Like that's the answer. You can use ESG-CV funding to do that. We need to clarify one piece there. You can't go and if they don't have one, or let's just say you don't have an HMIS for some odd reason in the COC, you're able to use ESG-CV funds to get an off-the-shelf software to ensure that you're compliant with HUD's requirements. So we don't anticipate seeing that with any HMIS systems, to be clear. However, we do anticipate seeing that with victim service providers. There is a provision in the notice that gives you a pass for 60 days. That's long gone. I did put it in the chat. and we can provide more context if you have questions about that. But if you're at a place where you know you're going to fund them, let's say you've done an RFP as a city and you're going to fund them, you need to ensure that you're funding the database part of it as well. And you absolutely can do that, and we are happy to do that, actually, because this builds capacity not only now, but in the future. And we have no problem building capacity for the future as well, especially since we don't know how long COVID-19 is going to last.
If I could follow up on that for just a second, too. If your DV provider absolutely cannot generate a CSV upload, then you need to put that question in the AAQ. You're going to need to have a plan with the victim service provider that includes a date for when that provider will get will get a comparable database. And you're going to have to document all of that, and it's going to be a real problem if they don't need it. So if you're funding a victim service provider, and we've been going through this for years, the first year you did the CAPER was supposed to be a one-time exception. Then year 2 came around and HUD let the one-time exception go to a 2-year exception. And then we went to a 3-year exception, and now HUD is saying, party's over. No more exceptions. If you have to give them an exception this time, they have to get a system that works. And so it's about as strong as they've ever been, and I would expect that the exception at the end of this time is going to go away. This is for real. They've got to get onto a comparable database.
Thank you. So we've got a question here. We know that there will be expenditures. However, we don't know what they are yet. So what do we report? We entered that, yes, we have a signed agreement, and said no for expenditures for now, and it does not let us put in projects. That's kind of 2 questions in one there.
So maybe I'll take a crack at the first one. I don't know the best way to approach the second part of that. But first part is give us what you have, right? You have until the 30th. We prefer that people don't wait until, right, like midnight on October 30th, of course. But you have until that long. See what you can get going after that and report what you can. There will be a process. I, again, can promise you it'll probably be painful just because going and editing the data once it's submitted will have some issues tied to it, but that process will be available if needs be. We know that jurisdictions are going to need that. You're all in different places right now. Many of you are going to reimburse to earlier costs, and you just don't know because you're getting your local RFPs. We totally understand that. I saw the FEMA example as well. A lot of folks are still working out with FEMA what gets reimbursed, what's not. You can't use ESG funds for the cost sharing, so you really don't know what's going to be used from ESG funds at all on those units until you have the full agreement with FEMA. So you're just going to have to do the best you can. If you are not sure, it's better to wait than to lie, right? If you're not sure, for instance, what's happening with FEMA, don't say, well, I'm not sure, so I should just report that we spent all of our money on that. That's not a good way to go. It's better to just hold off until your agreements are done. But again, we would encourage you to try to get what you can. There is a difference between we're still negotiating and figuring it out, and we aren't getting the data from our subrecipients. I guess at the end of the day, it's the same problem, but one is more of we need you to build your systems to get that data when it comes to like the financial side for how much has been spent by subs, and another is you just can't control FEMA's negotiation process. So please work on the things you can control and recognize that we know that there are things that are probably out of your control, and lots of things out of your control, to be totally honest. Let's see, Michelle, I think there was a second half to that, a technical piece.
Yeah, I think the first part of the question referred to what do you see. If you say you have no expenditures, then it's not going to let you expend. It's not going to let you put in projects until you've submitted and go to the next phase to the next report. So the way Sage works is if you have no expenses and you say no and you submit the report, then the next day a brand new report will open for you and you can go ahead and enter your projects. We don't want you entering projects that are sending out bundles if you really don't intend to get the CSVs from them. The fact of you setting up those projects and then bundling them sends an email to the HMIS telling the HMIS to submit data, and you can't do that if you don't have any data that you want submitted yet.
Okay. So we've got a question. What exactly is due on October 30th? Will an email be sent out for what is needed?
What is actually due is this report in Sage. You start by telling us where you are in the process. Have you executed your grant agreement? If yes, have you made any expenditures? If yes, then you're going to complete the report and submit it to HUD. If any of these are no, the screen right here will tell you what you have to do.
Yep, and one other clarification, people have been asking for the guidance associated with this. We've been working on the webinars, been doing them for the last month now with office hours. We will have guidance documents. I promise it's not out yet. We're finalizing it, and we will get it out to you as soon as possible. These webinars were intended to give you all that you need to, just in case there was a delay in it. And here we are. We don't have that out yet. It's kind of like reliving the ESG-CV notice, so let's hope it doesn't take that long. But it is nearly done, and we should have it to you shortly. But you essentially are going to report, as Michelle said, you're going to tell us what projects are being funded. You're going to tell us how much money you are associated with all your expenditures tied to your ESG-CV grant, and you're going to tell us about clients served. To the extent you use unique activities, you'll describe what those are and how they relate to your COVID-19 response. So it looks an awful lot like what you normally report. Quite honestly, if you do ESG reporting, we try to not change anything with relation to clients, the client data, so that should all look the same. And the financial data is here instead of in IDIS, so you report it there. The only real difference is the unique activity piece. So, but it's narrative. That should not be a big lift.
When the guidance is published by HUD, it'll be published on the HUD Exchange and or HUD.gov, and we will also have it linked here. When that is posted, and it will go up in Sage the same day that it's posted on the HUD Exchange, we'll put a system message in you telling you it's there, so you'll know that that's available to you.
And just as in case it wasn't clear what we were doing earlier, there are a lot of things in these slides that will look very familiar when the guidance comes out, because we wanted somehow to get it to you early. So somebody referenced the chart that was in one of the earlier slides, like how do we get that? Well, it'll be in the guidance, but we didn't want to wait that long. So we put it in the slide so you could have it sooner. Same with that discussion about temporary emergency shelter. That's going to look an awful lot like what we put in the guidance document. So why wait, right? We want to give it to you now, and you can take a look at it. There may be some tweaks to the wording a tiny bit, but the principles will be the same. And so we just wanted to put that in front of you as soon as possible. So I promise these slides are probably more helpful than you'll realize once you start to get into doing the reporting.
Thank you. If you check on the ESG-CV reporting requirements page there, Michelle, if you check homeless prevention and save, but then find out later there were no expenses, can you edit the form and take it back out?
Yes, if you haven't sent the bundles yet. So, go back. I don't think I'm in a state where the bundles haven't been sent. If you have not sent the bundles yet, there will be an action here that you can edit that bundle and get rid of it. Once you create the bundles, you can't get rid of it. If you needed to, you need to uncreate the bundles and come back and do that. And if you want to go on to the next question, I'll try to find a recipient that I can show you that.
Well, I think her question specifically was about in the step 1 in the start here step where you check the box that says prevention. Can you uncheck it?
Once you've completed it?
Yeah, in there.
No. Once you save that form, it's saved. If you really need to uncheck it, you really messed up, put an AAQ in and we'll uncheck it for you on the back side.
Hey, Michelle,
really, yeah.
Is there an alternative here? Let's say they didn't do any expenses. Is there any harm if they just put $0, or will that take them to the bundle stage and then there's a problem? Or can they just say, okay, whatever, I'm not going to uncheck it, but I'm not going to have anything to report?
If they checked hazard pay, no, that'll be fine. If they checked hazard pay, for example, and then they didn't have expenses for hazard pay, is that what you're saying, or homeless prevention, and they didn't have expenses? Sage is going to fuss at you if you are telling us you have a homeless prevention project and don't have an upload.
Yeah, that's really what I was trying to get at. So
yeah.
It would be a problem in the event that there's a bundle tied to it, because
yes.
they'll keep saying by bundle. Okay. All right.
Okay. We just submitted the ESG-CV Sage quarterly report. However, we are trying to complete and export the normal ESG report on Sage, but it's giving us the 2018 report instead of 2019. Is anyone else having this problem? That might be an AAQ.
It's not Sage that's giving you that. It's your comparable database that's giving you that, right? Or your HMIS. The HMIS has to be generating, or comparable database has to be generating an ESG-CV, an ESG CAPER 2020 report. It doesn't matter what year you're reporting on, it has to be that report. That report is the format that's tied to Sage, and that's the report that you have to use then to go into Sage.
Could it also be that they didn't actually submit their 18 report, so they're not seeing their 19 report in Sage?
If that's, yes, that could be.
Okay. Yeah, so Irma,
that may mean that you want to first talk to the recipient, Irma, to make sure that everyone's on the right page with the year for the report. And then if, in fact, they are on the right year, yes, you might want to follow up with your HMIS or OSNIUM partners as well.
The other thing that we've had several of this week were people that forgot to actually submit their CAPER last year. If you just press submit today on your CAPER, the new report doesn't generate until overnight, so you don't get a new report till overnight on your regular CAPER.
Okay. And then there's some follow-up in here. Maybe HMIS and OSNIUM need to be updated, question mark.
HMIS is probably updated. There is something a victim service provider has to do, physically has to do for OSNIUM to be updated, and they would have to speak to OSNIUM directly to get with that. The HMIS lead should make sure that every HMIS is updated, and we don't know one that isn't. So it shouldn't be the HMIS not being updated.
Yeah. Will the guidance include steps for the HMIS leads?
Minimal. It's not really targeted to the HMIS leads. We've talked with HMIS leads a lot, and the reality is the real work is with the recipient, right? Because the recipient is establishing the boundaries for the HMIS lead through the bundles. So the recipient says, I need all emergency shelter projects from this date to this date in your HMIS implementation, right? So at that point, I think leads know how to take that information, right? Because they say, well, I'm going to take these 10 projects, I'm going to run the CAPER template, and then and I'm going to put these date parameters, and I'm going to upload that. So for the most part, we think the HMIS leads, this shouldn't actually be much work for the HMIS leads. The real work is getting those bundles right and having that conversation between HMIS leads and recipients to make sure you have the right projects by the right time frames, by the right project types or component types here.
And the email will have, the reporting portal will have the information for the HMIS leads.
That's
Follow
correct.
the instructions. Okay, so just one more time to clarify, if we don't have an expenditure by October 1st, we still need to submit in Sage, correct?
So that's all triggered by your grant agreement, right? So if you don't have a grant agreement, you don't have to do anything in Sage. If you have a grant agreement but no expenditures, you will have to enter Sage, and you'll see the screen that Michelle is on right now. You'll enter yes to that first one, but then you'll enter no to the second question. Have you made any expenditures? And after that, you're going to go in and enter zeros on the financial form, and you're going to be done. So yes, you'll have to do something. It will be very, very minimal, but it all turns on whether or not you have a grant agreement to begin with.
Okay. The initial start for submission reports. Hold on. The initial start for submission reports are September 30th, 2020, and any activity submitted after September 30th, 2020 is due in the next submission?
Yeah. Yep. So all expenses between October 1st, 2020 and December 31st, 2020 will be reported in the next quarter, although starting in the next quarter, you're going to get the blessing of doing the cumulative reports over the life of the grant. So you're going to do 2 sets of CSVs, one just for the quarter and one for everything to date. And you'll do that every round. Obviously, you don't need it for the initial report because you only have those initial activities to report on.
Okay. And there's a follow-up. Can we submit today even though it's due tomorrow?
Yep.
There's nothing due tomorrow, though, to be clear.
Yeah, the important thing to realize is that you're reporting on everything through September 30th. So if you're positive, you're going to have no expenditures. Your subs are going to have no expenditures. No one's going to have any expenditures to report on. Oh, absolutely. If I were you, I'd go in today, log into Sage, say that I have a grant agreement, and say I have no expenditures, go to 0, submit it, and be done with it. If you are not sure that you have some expenditures, then I'd hold off. But, yeah, it looks like we answered your question there.
Were you going to show something, Michelle, before I moved on?
No, just again,
Okay.
back to the page, and I'm just trying to find a page I can switch the yes or no to. So if I said yes to that but no to this, you don't even have those options to check stuff. You just go ahead and save the form and fill in 0 on the financial form. You're done, and you can submit.
Okay. This person asks, if we only have expended funds for one shelter project, then can we just skip the part that deals with the bundles?
No.
No. Yeah, go ahead, Michelle.
No. You have to do your HMIS lead. You have to do that, send it to the HMIS lead, and bring it in.
Yeah, the bundle term is what's throwing you off. So even with a victim service provider, where they're providing based on a single project, they are going to have a quote-unquote bundle to submit. It's going to be a bundle of one. But the only way you're going to get the data is Sage has to have these bundles that get sent to the appropriate HMIS implementation or victim service provider. And so don't let the term bundle throw you off. You'll need to, every project is going to have be associated with at least one bundle or with a bundle.
Right. There are not any unanswered questions currently in the chat. So if you have any still, we have 15 minutes. Happy to keep going here. Please put them in.
Can you go, I saw a question earlier from, I think it's Charvandra, about the start screen.
Yeah.
And that's here, right? So just to be clear, this is what we're talking about with the start screen, I think, right?
Yes.
Is there something they're going to see when they log in? Is this the very first page they'll see?
This is the first thing on their page. See this? All of this is blank. All of this is not here if you have not checked this. All you're going to see is this. You'll come in and do that.
Perfect.
If you don't have access to Sage, we would assume it's because you're not a recipient. Only recipients need access to ESG-CV and Sage. No HMIS lead needs access, no sub-recipient, no sub-recipient. So if you don't have access, it would be because we assume you don't. If you are a recipient that used to have a staff person that was doing your ESG-CV and they've left, you can put in a request to create an account on the front page of Sage. When you log in, and once you do that, you can you should then put in an AAQ. It's right here. You create an account. You'd put in an AAQ to us and tell us that the person that used to have the authorization for you is no longer at the city or county or state, so that we know to turn it on for you.
I don't see any other questions beyond that, and we don't want to hold you. You are all very busy. We're happy to answer anything else, but other than that, you can use the AAQ, and we will let you all go. So last call, we'll wait about 10 seconds. All right. Thank you all so much. Good luck with reporting. Again, don't hesitate to send us emails via the AAQ, and we will do our best to respond quickly.
Thank you.